For those who are logging on, we're just going to give it about a minute or two before we get started. Hey, Victoria, I just noticed that you have UW alumni as your like one. That's my nice. All right, we'll go ahead and get started. I know Victoria has a lot of content she wants to share with you. So first of all, welcome everybody to the IFAM seminar series. I'm Abel Coe. I'm a direct the Center for Health Information Partnerships and also the new Institute for Augmented Intelligence in Medicine. And I'm really excited today to have with us Dr. Victoria Udalova. So by way of background, you know, as researchers, like many of us, we're always thinking about numerators and denominators, especially that our EPI colleagues. And many of us are working on social determinants of health and some of the sort of broader issues that affect people's health. And for that, you know, we might work with census data. We work with American Community Survey data, census data, and then some of us spend a lot of time thinking about record linkage. So, well, it turns out that Census Bureau, they think about these things too, and they do a lot of these things. In fact, they're expert in a lot of these, in the science behind some of these efforts. And what's nice, they also provide much of this data publicly by statute. And as you'll see today, they also conduct their own very interesting research sort of agendas. So I was really lucky to meet Dr. Victoria Udalova. Actually, in an odd way, we had a very unsuccessful grant we had submitted to, I think, Census Bureau, and then Bernie Black and I had a chance to sort of connect about this. And about 2 summers ago, Victoria was a very gracious host during a visit during the summer when I had a chance to meet with some of the folks there that do record linkage and learn about some of the exciting work that's happening. So with that, I'm really excited to then introduce Victoria. She's a senior economist and program manager at the Enhancing Health Data or Ehealth Program at the US Census Bureau, in which she leads the Census Bureau's initiative to combine health records with census data to create new statistics and expand research possibilities. So Dr. Udalova.
Thank you so much, Abel, for inviting me and for everyone who helped to organize my visit today. You know, you've been unbelievably thoughtful and welcoming, and I really, really appreciate it. I do have a lot of slides. I'm going to go through them fast, but the slides will be available, so no need to worry about writing down my different sources and websites. And so just kind of listen, and you know, you can always contact me too if you have additional questions. But with that, let me just tell you maybe a little bit about myself. So, you know, and Abel mentioned some of it, but I'm a trained economist. But in addition to it, I'm the program manager of the Enhancing Health Data or Ehealth Program, and I will tell you about that in a minute, kind of what we do. My research focuses, at least lately, on measuring social determinants of health and the characteristics of healthcare workforce. I'm the most passionate about building infrastructure to expand the use of health records, especially when linked to census data, to improve federal statistics and expand research possibilities. So some caveats about my presentation. So, the Census Bureau is a very large organization. We have lots of data, and you will see that in a minute when I kind of provide you some high-level overview. Data access can be complicated, lots of moving parts, data agreements, and confidentiality and data protections that we have to uphold. So the opinions today are really just my own, based on my experience as a researcher, as a proposal evaluator, also as the program manager. So that's kind of, take that for what it is. And like I said, questions are welcome, whether today, if we don't get to answering all of your questions today, you're welcome to contact me afterwards. I will have my contact information at the end. So I really would welcome your you reaching out if you have any questions. And like I said, slides, don't worry about writing it down. I'm not going to read the slides. There's a lot of information. They will be available to you. So, if I don't get to talk about maybe section at the end, you will be able to see the slides. And kind of the outline for my talk today is really kind of the four components to it. I will talk about the eHealth program, what it's about, what are we trying to do. I will then provide some very high level overview of data that we have available, restricted data that we have available through the FSRDC network, and I'll talk about what it is in a minute. I will then provide some examples of recent research projects using restricted data, just as a way to, just to give you some idea of how researchers using our restricted data, and maybe that will spur some of your own research ideas. And then if there is time, I will talk about proposal development very briefly, maybe just give you some tips on developing proposals and kind of how to approach that whole process. Okay, so, everyone knows the US Census Bureau as the agency that counts people every 10 years. And that is certainly what we do. That is the main function of ours. But we do so much more beyond that. There are 13 federal statistical agencies in the United States, and the Census Bureau is the largest agency. And our mission is to measure the nation's people and the economy. So it's a fairly broad mission. It's not specific to any particular area. We are governed, most of our activities are governed by Title 13 of the US Code. And what it does is it actually provides the authority for us to acquire and use administrative records to the greatest extent possible. And sorry, let me just minimizing the videos. So basically what we have is we have data from a variety of different federal agencies, from state and local governments, from private sources. We do research looking at record linkage. We are using alternative sources of data to develop new statistics or improve our existing surveys. And increasingly, there has been focus on blended data products. What I mean by that is, rather than us going and collecting information from individuals, we are trying to use administrative records data to supplement and sometimes even replace certain questions that we would normally ask on our surveys. Okay, so Enhancing Health Data Program, eHealth Program. It is a fairly newish, I guess at this point, maybe in existence for 5 to 6 years. It is a research program. We are focused on using administrative records, including health records, in order to improve measurement of patient and provider characteristics and advance our understanding of population health. How we do this? We are doing it through research and development of applications. We are linking multiple data sources and creating new statistical products. And we also conducting research, and sometimes that research is done in collaboration with our outside partners. So what it kind of also involves then is we build partnerships with state, federal, private, and academic organizations that hold health records. That's kind of our primary goal, is to be able to bring health records to the Census Bureau and demonstrate that when we link those records to other data assets we have at the Census Bureau, that this is really when we're utilizing its full potential. And we want to be able to produce data products that would would demonstrate those possibilities. And so, like I said, focuses on bringing health records and linking it to other data. We're looking at in terms of our scope, we're looking at patients. So for patients, we're interested in looking at social determinants of utilization and outcomes. On the provider side, we are interested in measuring healthcare workforce by specialty, geography, demographics, and also business structure. We have lots of business data at the Census Bureau. So we're interested in looking at the business structure and then seeing how those characteristics change over time. Ultimately, what we produce is, and like I said, sometimes it's just us, most of the time it is in collaboration with some outside partners, is we produce new experimental statistics, interactive dashboards, and research papers. So being very concrete in terms of our current projects, just being very specific here. For example, we have partnered with Utah Department of Health, and we're able to link their emergency department visit data to the restricted data from the American Community Survey, or the ACS survey. And the linkage is at the individual level. What that means then is we were able to attach individual level and household level social determinants of emergency department to those Utah records. An active dashboard and a working paper describing those fairly soon, but that's kind of an example of us being able to look at individual level social determinants of health. In terms of healthcare provider characteristics projects, this actually also a project that involves lots of different data sets across many federal agencies. This is where we got data from CMS that allows us to identify healthcare providers in our data. And we were able to link those records to data from IRS, data from SSA, as well as data from our surveys. And we can look at demographics, socioeconomic, again, business side elements. And we were able to create new estimates of physician earnings, something that was not available before. Again, looking at very detailed specialty, looking at detailed geography. And we're in the process of expanding that project to add kind of the business side component, seeing how providers are organized within their businesses, sole practitioners versus those owned by hospitals and so on. We do not have EHR data yet. We are actively working on it. We have several ongoing partnerships to bring EHR data, and we do have some successes. We're working with American Board of Family Medicine, ABFM, and Stanford University. They have EHR data, and we're going to have a three-way agreement that is at its final phase. We are also working with University of North Carolina Healthcare System. We were able to bring in a randomized sample from their EHR system, but it didn't have all the variables quite yet, but it has patient level data, demographic data, has some health insurance information, and we're documenting our lessons learned as part of that process in a joint paper. When the pandemic started last year, we also wanted to see how our existing data that we already have at the Census Bureau, how can it be used to examine mortality and economic disparities due to the pandemic. And so we pulled together several different administrative records data sets and some survey data, and in order to analyze those disparities. And I'll mention in a minute, we had a paper come out from that project. We've also been able to get some national Medicaid claims data. It's not 100%, but it is for people who responded to the American Community Survey. And so again, we're able to look at self-reported social determinants of health, education, poverty, access to transportation, internet access, right? All those determinants we can link them at the individual level to Medicaid claims data. And we do have a few demonstration projects looking at those relationships. Okay, so I do want to say that, when I talk about eHealth program and what we're trying to do, us trying to bring more health records to the Census Bureau, a lot of times we set those projects up as internal projects. So there's kind of, there are effectively two ways of accessing the data. There are internal projects, there are external projects, and kind of there are advantages and disadvantages, and they happen depending on different needs. Internal projects is generally what we have in the eHealth program so far, because we are really bringing in sensitive health records, and we need those records to include personally identifiable information to allow for linkages. So that involves lots of data agreements and legal and policy aspects. And so those are generally set up as internal projects, but we do have external partners who are supporting those projects. Everything I'm going to talk about from now on is focusing on external projects. So that is when external researchers have a particular research question and they feel like access to the restricted census microdata might help them answer that research question. So that's kind of the distinction I'm making here. And why would someone want to access restricted data? So I just have this list. It is not it's not everything. It's just a few things that I thought about. For once, and I've been alluding to that before, you can link data sets across multiple, so data across multiple data sources, and it's all at the person level, or on the business side, it is at the business level. So that is a big advantage. Because you can link across multiple data sources, it also means that you have an ability to look at long-run outcomes. As an example, 1940 census has been released recently, and researchers can now link 1940 census to 2010 census, right? And then you can try to identify parents and children and look at long-run outcomes. Another reason because we have lots of data on economic outcomes, so earnings data, labor force data. Or maybe it's because we can observe internally through a variety of different data sources, we can observe outcomes of other household members. So that's something you're interested, that would be another reason. And of course, social determinants of health, right? Just what do we have on social determinants of health? And I will talk about some of that in a minute, but we do have lots of information on social determinants of health: housing, transportation, poverty, race and ethnicity, lots of demographics. Another thing you might do is, if there is a randomized control trial, and if there are identifiers, okay, everything is kind of contingent on having identifiers in the data. But if there are identifiers, it's possible to attach additional outcomes, or even if this randomized control trial happened in the past, it is possible to look at long-run outcomes. We also have this great data asset that I feel like is underutilized, and so every time I get a chance, I advocate for it. But it is numident files that we get from the Social Security Administration that actually includes fact of death information, and it can actually be linked to other sources we have at the Census Bureau. I'll probably get another chance to mention about that later on. Usually restricted data would have additional detail within variables. So think about, maybe detailed occupation codes or detailed industry codes, maybe more categories within race and ethnicity. Usually there are additional variables. Not all variables are publicly available. So restricted data would have more variables, more observations. Of course, there's greater geographic detail. It will depend on which data set you're looking at, but sometimes you can go down to the block level. If you're looking at income, for example, internal data would have less severe tab coding, and sometimes that's important for depending on what you're doing, but that can make a big difference. And so then thinking about, okay, well, here are the reasons, right? But how would one go about accessing this restricted microdata for research? So restricted data can be accessed through the Federal Statistical Research Data Centers, or FSRDCs. The way to think of them is they are secure locations throughout the US, and typically they are attached to some academic institutions, but not always. There's always an on-site Census Bureau employee called administrator who helps researchers go through the whole application process and working there, the data center, and then be able to get the results out. So there is always someone who can help with that process. And in addition to the data from the Census Bureau that is made available through the FSRDC network, there are other federal agencies that actually use the same network to grant access to their restricted data. And I will tell you, I'll give you a couple examples in a minute of those agencies. But the thing about it is, at least right now, each agency has their own review process. So there is a review process by the Census Bureau if you're accessing data from the Census Bureau. But if there's a data set, say, from the National Center for Health Statistics, they might have their own, they will have their own review process and approval process. And you would actually need to get kind of both approvals in order to get access to their restricted data. There is a pilot going on right now to create common application, and I think that will really simplify lots of researchers' lives, but it's still in its pilot phase right now. Okay, so for those of you, I'm assuming you are all located in Chicago or in the Chicago area, and the Chicago location for the RDC is located at the Federal Reserve Bank of Chicago. The local administrator there is Frank Lenhouse, and I do have his email here, so he'll be able to answer any questions about the proposal review and data availability and things like that. And again, I'm talking about kind of just those external projects where you don't have an internal Census Bureau collaborator on your project. And there's a website too where you can go and get some up-to-date information. So Northwestern University is a partner, and so there are some perks that come along with that. Some fees are waived and things like that, but Frank will be able to tell you more about that. And in terms of who can get access and who can use the restricted data for approved purposes, and it's faculty or other researchers, graduate students working with advisors, and researchers must be either US citizens or foreign nationals who've been in the US for the last 3 out of 5 years. I think that's the rule. Okay, so let me now turn to talking about data availability. And I will go quick because there's lots of data, and so this is really high level. I'll have some resources for you to go look at more. But so this is kind of, think of it as a partial overview of what we have available. So focusing on the Census Bureau side first before going to other agencies. So the Census Bureau data that is available through the FSRDC network on the demographic side, of course, we have decennial censuses. You know, I've mentioned 1940 was available recently, and soon we'll have 2020 census. Long form version of decennial census included lots of demographic and socioeconomic characteristics. Our largest household survey is the American Community Survey. It's an annual survey, and we survey about 1 to 2% of the US population per year. So if you imagine that we have, what, 15, 17 years of data, 1 to 2%, so you can probably get 20 to 25% of the US population covered by the ACS data. And it's a household survey, lots of social determinants of health characteristics. And the great benefit, of course, is that you can link it, if you have access to the restricted data, you can link it at the individual level to other data sources that we have to look potentially at other outcomes. We have data from current population survey that usually there's, employment, unemployment. There are some supplements too. We have American Housing Survey where you can get some characteristics of homes and housing costs and things like that. And I just have this slide here to show you detailed geography. I really love this graphic where you can kind of see there are so many different geographic levels. And really the point here that I want to make is, depending on what you need in terms of geography, different data sets will have it. And so, sometimes you can go down all the way to, honestly, sometimes with restricted data at Census, you can actually go down to an address level, and from there you can aggregate it to whichever geography you need for your particular study. And here's just the link for a bit more information on what other restricted data we have in terms of kind of on the person side, so demographic data. So turning to economic data, and actually that's a bit of a kind of difference here that I want to emphasize. On the demographic side, some of our data sets are made publicly available. So for ACS, right, you can get PUMS data. So you kind of have some ability to use public data. If you want data on businesses, for the most part, you have to go through the whole process of getting access to the restricted data. There are no public versions of establishment level data. The good thing here, though, we do have detailed geographies and industries, and you can link data over time, and you can actually look at employees, so you can have people and their characteristics, and you can look at their employers and their characteristics, and kind of there's the crosswalk. And that is this LEHD data, which basically takes administrative records data from states' UI unemployment insurance systems. And again, it's really great because you're looking at workers and you know their employment history, and you know their wages, you know their individual characteristics, but then you can also link them to employers, and you know about employers' industry and total payroll and their location, right? So it's a really powerful data set. Okay, so that was a really like two-minute overview of the Census Bureau data. Does not give it justice, but it is what it is. There's a lot more. But the National Center for Health Statistics, NCHS, they actually also make their restricted data available through the FSRDC network. And so I just want to take a minute to mention their data. The benefits of accessing restricted NCHS data are very similar to the benefits I've already mentioned to you. You can get more geographic detail, you can get additional variables, sometimes there are sensitive topics, you can get children's vital information, and NCHS actually links their data to other data sets. So they'll link it to mortality files, they'll link it to social security files, they link it to Medicare and Medicaid files. So there are some linkages that NCHS already do that, again, depending on your need, they may already have the linkage that you might be thinking about. And here are just some examples, kind of I put their data sets in buckets. This is not a comprehensive list, but they do have population surveys. So you get some health utilization, health outcomes data at kind of at the patient level. They have vital records, they have provider surveys, and the process of getting access to the restricted NCHS data is going to be different from the process of getting access to the restricted census data or data located at the Census Bureau. And so it's a separate process. There would kind of the FSRDC would need to approve the proposal, and then NCHS would need to approve proposal. And the way usually they do it is they would create a custom extract for your particular project, and so you would only have access to just that extract that was created. And I have a few links here where you can actually read more about their particular process. So HRQ, they actually also make their restricted data available through the FSRDC network. And specifically their MAPS survey, there's a restricted version of MAP, there's public version of MAPS, there's restricted version of MAPS, and restricted version of MAPS, they have greater geographic detail, they have fully specified ICD codes. Actually, for my dissertation, I've used restricted version of MAPS data where I did need county and state, and I did need fully specified ICD codes. So this is, you know, it's a great resource. And similarly to NCHS, AHRQ would need to review the proposal, and they have their own process of how you would go about getting access to their data. Okay, so kind of coming back a little bit to the Census Bureau side, and so I don't want to confuse you, but kind of at the Census Bureau, right, we do acquire data from, like I said, from state and federal agencies. And so at the Census Bureau, we have this numetent. I mentioned that before. So that it comes from the Social Security Administration. It has birth and death dates. It has place of birth, and it's a very, very powerful and I think understudied or underused resource, because you can actually link it at the individual level to everything, basically everything else we have at the Census Bureau. In terms of federal data, we have data from IRS, we have data from HUD on housing. There's some data, we do have data from Medicaid and Medicare enrollment, VA. From states, we do get data on WIC and TANF and SNAP participation. We don't have every data for every state, but many of the states we do have covered. There's also some third-party data, and I did want to mention this last bullet point on master address file. So we do have a complete list of addresses. I mean, we need that for conducting our decennial census, of course, but it is useful beyond that, where you can actually observe individuals' location. It's an annual data set, so you can observe individuals' location over time, and you can then aggregate it to basically whichever geography that is needed for your particular study. Okay, linking data. So I have been talking to you a lot about linking data, and I just want to take half a minute to explain how we do it at the Census Bureau, which I think is a bit different from how other organizations are doing it. I am not an expert on data linkage at all, so this is just kind of my understanding of how things work. Basically, we have what we call this reference file. And this reference file, the backbone of it is the data from Social Security Administration. So people in the US who have SSNs, Social Security numbers. So that's the backbone. And to that, we add lots of other survey data, lots of other administrative records data. And so we kind of have this big agglomeration of various records at the individual level. And then all the data that we have at Census, so all the survey data, all the admin records data that have PII, and most of our data sets do have PII, so personally identifiable information, we then try to find, using probabilistic matching, try to find if there's a match to this reference file. And if there is a match, then PII gets dropped and is replaced with a unique anonymized internal linkage key, and we call those keys protected identification keys, or PICs. And so basically every data set would have PICs. So researchers and data analysts working with data at Census actually do not see PII. Only a small group of people who have access to PII information. Most researchers just have PIC, and that's, you use PIC to link across different data sources. Okay, and in terms of match keys, you know, we use SSNs, we use address, name, date of birth. I feel like that's fairly standard, but you know, it really depends on what elements are available in the data that we bring in. Okay, so let me quickly go through, probably take a few minutes to go through recent research examples. Again, just very quickly, but just to kind of give you an idea what's possible with restricted data. Okay, so example number one. Researchers here were interested in what is the effect of variation in the generosity of SNAP benefits on children's health? And they are using restricted national health interview survey to link the data to regional food prices. They needed state and county of residence identifiers. And so that's the reason that they needed to go and get access to the restricted data. Example 2, what are the long run impacts of childhood exposure to food stamps on individuals' adult economic productivity and well-being? And so for this project, researchers used 2000 long-form census and then American Community Survey data, and they linked it to the Numidin file. And they needed it because they wanted to get place of birth and death dates. That's the value of the Numidin file that I was mentioning earlier. But here's an example of how the researchers were able to successfully use it. I do have to say that, looking at that, given that I am an economist, my list here is a bit skewed towards primarily economic publications, but hopeful that still you can still see the value of restricted data. Even though I'm being a bit biased here, and that's the literature that I tend to read. So here in this example, the authors wanted to see what are the long-run consequences of early life exposure to Medicaid for pregnant women and their infants. And here they were using restricted data from the National Health Interview Survey, so that's the NCHS data. They got state of birth, and then they were using American Community Survey to get year and month of birth, and also because the internal ACS data has larger sample sizes, so that was what was needed for their study. So here's an example of researchers using our business data. So here the question is, what are the effects of physician practice organization and market concentration on prices negotiated with private insurers? And here the researchers are using LBD, which is our longitudinal business database, economic census and business register. And they wanted to look at total payroll and sales. So there's a lot of linkages here, but this is kind of an example of how you can use business side data to answer some questions. Okay. Here the question is, what are the long run effects of early life exposure to extreme temperatures on measures of individuals' economic well-being? Here researchers are using LHD data. I mentioned that's the linkage between employees and employers, and they're able to get county and exact date of birth, and they combine that with daily weather data. So that's another example where researchers were able to bring in outside data. They have weather data, and they linked it internally to LHD data. So next to this is my own work, so for full disclosure, but I thought I'll take a minute to mention. I do mention here that it's part of our internal project, well, because I'm the kind of the internal collaborator. But this is where we got data from CMS. We got the NPI registry data and linked it to IRS records and ACS data. And we're able to create new estimates of physician earnings by detailed specialty and geography. And like I said, we're currently in the process of expanding that to include some business characteristics to physicians as well. And this is an example of using our data to look at racial disparities in excess all-cause mortality. We've done it, so we're looking at the first wave of the COVID-19 pandemic, and we were able to look at geographic variation in racial disparities. We're using death records from the Numidin. We are linking it to our master address file to get geography. We are linking it to census data to get information on race and ethnicity. So lots of data linkages here, but this is an example of how one can use Numident and attach other characteristics to it. So very powerful. So I just have a link here. Every year, there's a report that actually lists publications that came out from the FSRDC network. And so if you're curious, you can find a lot more examples of what is possible, what people have done before, how did they use the data. So I think this is also a pretty good resource if you're interested. Okay, proposal process. And I'm being mindful of time. I know I want to make sure to leave some time for questions at the end. So I'm going to go through this quickly. But here's kind of how the process works. There's going to be this, the local administrator, I mentioned in your case, Frank, he'll be kind of your starting person. So you'll contact him and kind of tell him what you want to do, and then he will give you the starter packet. You'll then write your first draft, and that is going to be first draft. There's going to be a lot of kind of back and forth, and you're gonna get to a point where your administrator says, okay, I think it's good. But you're gonna have to get to that point. At the same time, you're gonna have to write a benefit statement, basically saying what are the benefits that your research would provide to the Census Bureau. And I'll mention that in a minute, what we mean by that. When you do have your benefit statement and you have your proposal, you submit it to your administrator, and then when they approve it, it goes to the Census Bureau for review and approval. And once it's approved, if you do need other agency approval, that's the time when you would start working on that. If not, you are all set on the approval side, but you still have to go through the background check, and you need to receive special sworn status, SSS. And I will mention about that too. Timeline of projects. So approved projects, they generally last for 3 to 5 years. In your proposal, you would mention major milestones. So you would talk about what are you going to do in year 1, I will do this, and in year 2, I will do that. Extensions often not granted, and for some disciplines, 3 to 5 years feels like a long time. I know for economics, sometimes it's not enough to even produce 1 paper. So but there's something to keep in mind. That's the timeline. And when you're writing your proposal, keep in mind that your audience, people who are reviewing your proposal, are people who work at the Census Bureau. So mostly data experts who care about data, who care about your sample and your measures. So kind of, we don't have, policy experts. We mostly have math stats and statisticians and demographers and sociologists and economists and other data type people. But what are we really looking for in a proposal? Well, one, it has to have some benefits to the Census Bureau, and I'll show you a list of those benefits. It has to be feasible given the data. You do need to be very explicit about your statistical methods. It has to have scientific merit, and having a grant, for example, would kind of go a long way of showing it. There's a clear need for restricted data. So why can't you use public data, right? That question has to be answered. And then it also needs to indicate that you understand that on the other end, when you do all your analysis, that you understand that there's going to be disclosure, there's some disclosure avoidance protections that are going to be applied to your data, and that all the output will be reviewed to make sure that no one is identified. Because you really cannot take out restricted microdata. It's going to have to be aggregated output that is leaving the Census Bureau. So here are just a few tips. I'm not going to go through that in the interest of time, but I'll just say that be very specific and demonstrate that you've thought about the data and that you've tried to do as much as you could using public data. Be very specific what benefit the Census Bureau gets from your work. And do not make any policy recommendations. We are a federal statistical agency. We do not make policy recommendations. So don't do that. And one thing too, I would say is you can bring in any data you have, maybe you have a data sharing agreement with some organization and you have data, restricted data, and it has PII, and you would like to bring it to the Census Bureau and have it picked, right? Kind of again, having those attach those internal linkage keys. There is a process for that. There are some fees associated with that, but there is a process for that. So just keep that in mind. Benefits to the Census Bureau. It's a serious requirement to access the restricted data. There has to be at least 2 benefits, and your administrator will help you. Here's the list. I'm not going to go through that. I've highlighted some that are used commonly and in a fairly kind of there's scope for kind of frame your project in a way that would satisfy those benefits. Okay. Timeline, you know, this is a bit scary for people, and that's understandable. It is a major commitment. You have to develop the proposal. You have to wait for it to be reviewed and approved. And if you're getting data, if you're waiting on approval from another agency, then you add that approval time. Then you have to get your SSS, right? The background check. That will take another month or 2. So that it is definitely a commitment. And kind of that special swan status that I mentioned, basically what it is you're going to provide lots of documentation and lots of information about yourself. You're going to have some trainings. You're going to have some, there's going to be some fingerprinting. They will do a background check on you. But once you have it, you can actually work on different projects. So it's not like you get this SSS and you can only work on that one project that you proposed. Once you have it, it kind of stays with you and you can actually work on multiple projects. So if later you have another project, SSS status will stay with you. And I think this is my last slide, and then we'll open it up for questions. But as a reviewer, looking at proposals, here are kind of just a few final tips on that. When you think about accessing restricted data this way, think about your research agenda. Think about over the next several years and plan 4 to 5 papers. So because there's such a time commitment up front, such a high cost up front, that it will be nice, right, to kind of then the benefits would be coming over a long period of time in the future. Also, when you're writing your proposal, again, show that you know the data, that you've looked at the data dictionary. Again, we are the data people, so you want to demonstrate that you're working with your administrator, you understand the data, you've tried public data, and for whatever reason it didn't work, and you need restricted data. And just plan for this timeline. Know that it's going to take time, and SSS paperwork. It's going to seem like there's a lot, and there is a lot, but do it as fast as you can, because from the time you submit it, the process starts, and then you can do other things, right, for 2 months while you're waiting. So do that as soon as you can. So with that, I just want to say, please feel free to contact me afterwards. You will have my contact information here. Ehealth website, it is forthcoming. We're working on it right now. So we actually have information, some of those current projects I've mentioned. You'll be able to actually see our papers and our dashboards and everything we're doing. Here's the link. It's going to be live hopefully in the next couple of weeks. A bit more information and Frank's contact information. And with that, I'll stop and see if anyone has any questions. Thank you so much.
Victoria, thank you so much for that talk. I have to say that when I learned about the Census Bureau, it's a little bit like having gone your whole life to like the corner store and then walking into like Costco. You're just like stunned. Like, I can't believe the volume of what you're seeing here. And just two just editorial comments. One is that the process for special sworn status and to get access to restricted data, it's not that terrible. So we've had 2 of our students have gone through that process, and it didn't take them quite very long, and that was even before in the run up to the latest decennial. So that's I think was a good sign. And then these truly are data people. So when I recall when I was there and had a chance to give a talk, people are really data savvy, and it was a lot of fun because you could really get into the weeds very quickly and really get into some really interesting discussions. So really a wonderful resource. I'd encourage folks to put their questions into the Q&A. And I think there is one I see that I'll just read back. It just said, if I wanted to merge an exciting study cohort to Census Bureau data, what kind of identifier do I need to have for each participant in that cohort?
That's a great question. So we would want personally identifiable information. You know, if you have SSN, that's ideal, right? That's like the best you could possibly have. If you don't have SSN, but you have last 4 digits of SSN, that's also great. If you don't have SSN at all, then we would want full name, date of birth, address, sex. I would say that those are the main ones. That and you can get pretty high. The pick rate, I call it pick rate, right? That's the internal linkage rate. But pick rate is very high if data have SSNs. But it's not terrible if you don't have SSNs, but you have full name, date of birth, sex, and address. It depends on quality of data, of course, but it's not terrible. There are issues, of course, because you're not capturing everyone. Then the question is, well, how representative are your linked sample then, right? And we know that there are certain populations that for whom pick rate is lower. You know, people who are moving, so you know, they don't stay at one location, they frequently move, so maybe younger adults, so their pick rate is going to be lower. Minority populations, immigrant populations, people who don't have SSNs. So there are some populations that are being underrepresented, and researchers sometimes correct for that, maybe using inverse probability weighting. But that is just something to keep in mind when you're working with the linked data.
Yeah. And actually, again, just a comment, like the Census Bureau really has top flight linkage people. In fact, because they've been thinking about linkage forever, a lot of the like sort of original literature and original science around linkage really has been coming from Census Bureau. Sort of related to that, though, I was wondering, you know, you mentioned sex. The concept of a person's identity is constantly evolving. It's not static. It changes. It's been changing over time, especially recently. So even the ideas of gender identity, all these sort of constructs. Is the Census Bureau, how are they thinking of this? I mean, are they involved in discussions about how to incorporate that, how to adjust, for example, your linkage? You may in the future decide that gender used to be a binary construct. Now that it's no longer binary, how does that play into your approach going forward?
You know, that is a good question. I'm not on the data linkage team, so I don't know. All I would say is you are right. So we were actually at the kind of forefront of the data linkage back then, right? When we first developed our linkage infrastructure. And there is now an ongoing effort to reevaluate our existing linkage solutions and see if maybe there are some other better methods out there that we can try to incorporate. And I'm sure that kind of that issue that you just brought up they will be taking that into account and seeing if what needs to be adjusted to account for that.
Yeah, I mean, certainly we've seen, like, especially when you're doing the electronic health record linkage in the EHRs, oftentimes social security numbers have been really less and less used, you know, and so even in the clinical sense, how we do linkage has been changing. One question I was going to ask on behalf of the folks that listen to is, with the restricted data, can you say a bit more about like what happens after you complete your analysis? I mean, what additional layers do people have to go to? I mean, because you'd hate to go all the way down and be like, oh, you know, like in terms of publications review, that kind of stuff. What are sort of other?
That's a great question, and I will answer that kind of from the Census Bureau perspective. You know, I can't speak for NCHS and HRQ; they have their own process. From the Census Bureau perspective, and focusing on the external projects, right? When there's an external researcher, they go through the FSRDC network, and the only thing they really need to do once they have the analysis done is to go through our disclosure review process. Basically, when you have your tables and you have your graphs and you have your maps and you have your, you know, all of your regression tables, there's going to be someone who will look at them to make sure that you apply all the rules correctly. So we have, you know, you're going to have to apply some rounding. You're going to have to, you know, you can't have more than 4 significant digits. If there are some cells that have fewer observations, right? There's a particular threshold that you have to follow. Those will have to be suppressed. So if you follow all those rules, somebody will then look at your output to make sure that you follow the rules, and then no one can be identified if we were to release that output. And so that's really the only thing you have to worry about. Once the output is disclosed, they're going to give you a disclosure number, and every time you present or you write your paper, you're going to put on the footnote, here's the disclosure number, it's been reviewed, and you're good to go. For the internal project, it's a little bit more complicated, and that's why I'm saying internal projects, there's benefit, right? There are benefits. You do it for some reasons because you kind of have this internal champion, and there are mutual benefits, and so there are many reasons you would want to set it up as an internal project. But the somewhat of a downside, I guess, it depends on kind of who you talk to, but there is a bit more involved process. So if the Census Bureau's name is on a publication, right? So if I'm a co-author and my name is on the publication, we have to go through internal review. That would include statistical review. We would have peer review. We would have fact check. Of course, we also have disclosure review, but there are kind of a few more steps that we need to do in order to kind of say, okay, Victoria Udalova, Census Bureau on that publication.
Great. And the other thing I was to ask you is you mentioned e-health, and can you give us any more insight about sort of like what are the Census Bureau priorities in this area? I mean, you're describing some linkages with Utah public health and then North Carolina. Is there like priority areas that the Census Bureau is sort of moving towards? And is there any input into that process? Like, or how is that sort of shaped?
Yeah, it's a good question. So a lot of what we've done so far has been driven by our conversations with our partners. So our bigger goal is to demonstrate the value of linking health records to census data, and filling in that gap that exists where we can say a lot more about social determinants of health. We can provide more estimates of healthcare provider characteristics, right? We can do a lot more that other researchers and the general public would benefit. But we had to start somewhere. And where we started was by approaching partners who have health data that they would be willing to share with us. And they would be able to, and of course it has to be with PII so that we can link it. And it's very involved, the whole process, right? The data agreements and legal and policy aspects of it. But the way we approach it is we would negotiate and say, okay, let's come up with some use cases that is of interest to the Census Bureau, but also is of interest to our partners. So with Utah, actually, as an example, prior to the pandemic, one of the things they were particularly interested about is how can they reduce use of their emergency departments for preventable condition, reduce visits and reduce costs associated with those visits. And so they were thinking, okay, can your data tell us something about people who go to ER for those conditions? And yes, we could. When we link their data to ACS, and just give you one example, we look at people's income. And if you plot income on your x-axis, and then on your y-axis, you look at prevalence of preventable emergency department visits, you find this striking gradient where people on the lower income spectrum use emergency departments for preventable conditions at a such higher rate relative to people who on the higher end of the income distribution. And if you look at true emergencies, right, you walking and break your leg, there is no gradient in income. Right. So that, and we know that from kind of right, there is some evidence before, we know that, and that's, but just to see that when it's done like at that level, at the individual level, is quite exciting.
Well, I know we're at time, and I'm going to ask you more about that when we have a follow-up shortly. So, because I think there's, I think an interest, in maybe getting in queue, so to speak, with some of these ideas and partners. So, but I just want to again thank you for taking the time for a great talk. For opening our perspectives that this resource is there available and can be sort of accessed. So again, thank you for your time, Victoria. Look forward to working with you again very, very soon.
Thank you so much for having me. I enjoyed it. Thank you.
Thanks, Victoria. See you. Bye-bye.
Thanks.